Today marks the second day of a widespread polio vaccination drive in Gaza. According to Palestinian and UN officials, more than 80,000 children were vaccinated in central areas of Gaza on Sunday, the first day of the campaign. Israel and Hamas have agreed to three localized pauses in fighting to allow for the vaccinations. Gaza's healthcare system has been devastated by the war. Let's bring on UNICEF's Kazem Khalaf now just to talk to us about this. Thank you so much for your time this afternoon. So we understand, of course, that over 1 million of the polio vaccines arrived a few days ago in Gaza. When you consider that polio mostly affects children under the age of 5, one can only imagine how quickly these vaccinations need to be administered. Just talk to us about how difficult a task this is proving in terms of distribution.
Indeed, it is exactly as you would just describe it. It's very challenging, to be honest. We barely managed to purchase, in UNICEF purchase and release from the airport 1.23 million doses of polio type 2. And we pushed them into Gaza. About 2 weeks before that, our colleagues were working on the awareness raising, making people, mobilizing people to accept the vaccine and so on. So the negotiations with all parties resulted into dividing the Gaza Strip in 3 areas, which is really unprecedented for a vaccination campaign. But we just have to accept. We started yesterday in the middle of the Gaza Strip. The target is to vaccinate 640,000 children below 10 for the first round, and the same number for the second round, which will follow in about a month. So far, I would say things seem to be on track, and people are more and more coming to the vaccination points, and as well they are well receiving the mobile health teams that go there, just move and tour between the tents of the IDPs, the internally displaced people holding the vaccines and administer them to their children.
And just given the fact that, Kazem, the infrastructure, the health infrastructure in Gaza is really holding on by a thread, we understand, of course, because of this ongoing war. How difficult is it then, to administer children, particularly outside of well-established infrastructure? Or do you have to then, actually go to where these camps are and also where the children are? Just talk to us about that particular process, given the fact that we do understand the healthcare system has really been devastated by this war.
Look, it's very difficult in Gaza. The infrastructure is destroyed. I can say not even one single hospital functions fully. Lots and lots of the medical care and health centers are actually destroyed. If not, then they sustain certain damage. So it is indeed challenging. But what we're trying to do, and we have to do it, right? What we're trying to do is to just move to where the children are, and whoever can make it, any parent that can make it with the children to the nearest health center will also do that. So it's a twofold, I would say, campaign. We either go to them or they get to the health centers. But this is as well very challenging because, first of all, we would like to see calm, we would like to see tranquility, as in no bombardment, no nothing. So far, I could say things seem to be on the right track when it comes to the designated areas. However, it is not that easy to get to either to the IDPs, the internally displaced people, or them to get to the closest health center because the roads are pretty much destroyed, and walking there is a challenge itself. Everything is almost missing. However, luckily, people seem to be welcoming this campaign and realizing the importance of it, and they're bringing their children, they're doing their utmost to bring the children to take the vaccine.
And I mean, amongst those people who appreciate how important this is of course, Israel and Hamas having agreed to these 3 localized pauses. Just in as far as your, operations are concerned, I mean, how concerned are you that the likelihood of there being violence, even though we understand, of course, there has been a pause in fighting? We've seen in previous occasions how there was a sense of a passage openings or ceasefire of some sort, never really being honored in the previous infighting that we've seen. How concerned are you about that possibility?
We are concerned, I have to admit, frankly speaking. So we're monitoring the situation like hour by hour, and fingers are always crossed. However, things seem to be moving in the right direction simply because whether the parties like it or not, it's for everybody's interest to have this campaign as a successful campaign. By the way, speaking of success, we have to hit the target of 90% and above coverage. So the virus does not recognize military action, does not recognize bombardment, does not recognize siege or borders or what have you. So this is indeed everybody's interest. So this might be one of the reasons why we say that so far things seem to be on track, and hopefully, fingers crossed, it will continue to be like that till we get to hit the 90% ceiling.
All right, Kazem, thank you so much for your time and coming on to the show. Of course, UNICEF's Kazem Abu Khalaf from UNICEF. They're just talking to us there about that polio exercise. Of course, over 600,000 young children have to be vaccinated in a short space of time.